In this question, a 65-year-old woman presents with sudden onset chest heaviness and shortness of breath for an hour. And her medical history is significant for type 2 diabetes, mellitus, obesity, and hypertension. Temperature is 36.7, blood pressure is 80 by 50, and pulse is 110 per minute. Respiration are 20 per minute. Her ECG findings are ST elevation in the lateral leads. So what will it will lead us towards the shock because BP is extremely low and ECG shows there is some cardiac pathology. What are the hemodynamic changes? In this, before answering the question, let us study the parameters and how will we differentiate between the different types of shock. So here I have mentioned the types of shock, but we are mainly concerned about how we are going to differentiate between various types. First, starting with the cardiogenic shock. What is the primary disturbance in the cardiogenic shock? It is the left ventricular failure. So heart is not able to pump enough blood. What will happen if heart is not able to pump enough blood? It will cause pooling of the blood in the pulmonary vasculature, which ultimately lead to pooling of the blood in your venous vasculature. That increases the pulmonary capillary wedge pressure in the lungs and then towards the right side of the heart, and which ultimately leads to pooling of blood in the venous circulation. That leads to rise in the central venous pressure. So both the pressures, the central venous pressure and pulmonary capillary wedge pressure have elevated. And what will happen if the heart is not able to pump enough blood? The cardiac output will decrease, and the body will try to compensate for the decreased cardiac output by increasing the vascular resistance to maintain the blood pressure and to maintain the tissue perfusion. So systemic vascular resistance will increase. This is our body's response to manage the declining cardiac output and to provide adequate perfusion to the tissues. That's what happened in the cardiogenic shock. How will you differentiate it from obstructive shock? So the primary disturbance in the obstructive shock is impeded cardiopulmonary blood flow. So the right side of the heart is not able to pump blood towards the lung, which will cause pooling of blood into the venous vasculature that will raise the central venous pressure. But will it raise the pulmonary capillary wedge pressure? No. Unlike cardiogenic shock, here the pulmonary capillary wedge pressure decreases or lowers because the right side of the heart is not able to pump the blood towards the lungs, which ultimately leads to a low cardiac output or decreased cardiac output, and the heart and our body will try to compensate, and in the same mechanism follows and systemic vascular resistance increases. What will happen in the case of hypovolemic shock? In hypovolemic shock, our body, the primary disturbance is decreased blood volume. So if the blood volume has been decreased, what will happen? That central venous pressure will drop when when a decreased amount of blood is coming back towards the heart. The output will decrease, the pulmonary capillary wedge pressure will decrease, but our body will still try to compensate the low output by increasing the vascular resistance and trying to maintain the blood pressure by increasing systemic vascular resistance, right? What will happen in a septic shock? The septic shock follows the primary disturbance in the septic shock will be peripheral vasodilation. Why? Because of the infection and sepsis going on. So what will happen? The systemic vascular resistance will decrease. Now the systemic vascular resistance is decreased, so our cardiac output will increase due to decreased afterload. When our cardiac output due to a decreased peripheral vasodilation, the central venous pressure will also decrease, and due to decreased central venous pressure, the pulmonary capillary wedge pressure will also decrease. I know that sounds overwhelming, but you need to understand the core concepts. What is the primary disturbance and how it affects everything? While answering the question, this is the map that you should follow or you should keep in the mind. First, look at the cardiac output. If it is decreased, then you know that that we are considering shock, and the patient is in some sort of shock. How will you differentiate between the shock? By looking at systemic vascular resistance. Either it has decreased or increased. If it is decreased, it is distributive shock due to peripheral vasodilation. If it is increased, then look at the central venous pressure and pulmonary capillary wedge pressure. If both pressures are low, it means there is massive blood loss. So the cause will be hypovolemic shock. Or if it is high, it means that patient is in cardiogenic shock. Heart is not able to pump the blood forward. So there is venous pooling, and there is pooling of the blood in the pulmonary vasculature. What happens in obstructive shock? It can follow the same pattern as cardiogenic shock as in cardiac tamponade, but there are other but in all other cases, pulmonary capillary wedge pressure will be low and central venous pressure will be high. So coming back to our question, so how would you interpret it? First, you will see that the cardiac output has been decreased in option A, B, and C. So they can be the correct options. Option D would be eliminated as it is as the cardiac output has been decreased in this option. So after that, after eliminating the option D, there is no systemic vascular resistance given here, so we will focus on the pressures. So in cardiogenic shock, both the pressures would be elevated, so the correct option should be option number B.